Why pregnant women are mostly prone to infection throughout their pregnancy journey. Pregnant women are prone to infection due to combination of some factors which are physiological, immunological, hormonal changes that occur during pregnancy. The third point or the third factor is physiological changes. So during pregnancy, there are changes in the cardiovascular system, respiratory system, urinary tract, and gastrointestinal system. Now let's take cardiovascular system. So pregnancy leads to significant changes in the cardiovascular system, including increased blood volume and cardiac output. These changes can alter blood flow to various organs, potentially affecting the body's ability to clear infections. The increased blood flow also increases the workload on the kidneys, which can predispose pregnant women to UTIs or urinary tract infections. The respiratory system also, it undergoes adaptation. The respiratory system undergoes adaptation during pregnancy, such as increased oxygen demand and changes in the diaphragm's position due to the growing of the uterus. These changes can make the lungs more susceptible to infections like pneumonia. Moreover, urinary tracts also expand. So the expanding of the uterus can compress the bladder and the urinary tract, leading to incomplete bladder emptying. So once the uterus is growing, it compresses the bladder. So they mostly feel the urge to empty their bladder, but they don't empty it completely due to that physiological change, the compression of the bladder. And this will cause urinary stasis, which creates an environment conducive for bacterial growth, increasing the risk of UTIs. Also, the gastrointestinal system. Pregnancy hormones can slow gastrointestinal motility, leading to constipation and altered bowel function. These changes can predispose pregnant women to gastrointestinal infections. Now, the other factor is nutritional demand. So, there will be increased nutritional requirement during pregnancy. So, pregnant women have increased nutritional needs, particularly for vitamins and minerals that support both maternal health and fetal development. So deficiency in certain nutrients such as iron, zinc, and vitamin D can impair immune functions, making the body more susceptible to infections. Also, anemia. Iron deficiency anemia is the commonest anemia during pregnancy due to increased iron demands of the developing fetus and the placenta. And anemia can weaken the immune system, making it harder to fight infection. Therefore, putting pregnant women risks or making them more susceptible to infections. Now, let's look at other environmental factors that also increase exposure to pathogens, causing them to be more susceptible to infections. So, pregnant women may have increased exposure to pathogens due to changes in behavior or lifestyle, such as increase to visit healthcare settings. The monthly or the weekly antenatal care makes them more frequent to the healthcare system. Also makes them increase their risks or increase their exposure to bacteria or to microorganisms, causing them or putting them at risk of having infections. Let's put it that way. Now, in certain cases, pregnancy can lead to increased exposure to foodborne pathogens due to changes in diet or cravings. Pregnant women have a wide range of cravings. So, in diet or cravings for certain food that may not be adequately cooked or prepared. So, these can also put them at risk or make them more susceptible to infections. Pregnant women with young children may be exposed to infectious agents especially viruses like the cytomegalovirus and the parvovirus B19, which are more common in childcare settings. And most pregnant women are always close or are having close contact with children or kids. So these are some of the environmental factors that can also put a pregnant woman at risk or make a pregnant woman more susceptible to infections. Now, when all these infections are in place, there are infections related complications that can rise as a result of a pregnant woman catching an infection like an influenza virus infection. So infections during pregnancy can be more severe and can lead to complications for both the mother and the fetus. For example, pregnant women at higher risk of severe influenza, which can lead to pneumonia and other serious respiratory issues. Certain infections like listeriosis or toxoplasmosis can cross the placenta, infect the fetus, and can lead to severe outcomes such as miscarriage, preterm birth, or congenital infections. So there is a need for a pregnant woman to take very good care of herself to avoid infection, which may later lead to complications. Infection during pregnancy can increase the risk of adverse outcomes, including preterm, as I mentioned earlier, preterm labor, as I mentioned earlier, low birth weight, and intrauterine growth restriction as well. Maternal infection can also have long-term effects on the child, such as developmental delays or chronic health conditions. So these are some of the complications relating to infection during pregnancy. And now we know that these are some factors making a pregnant woman more susceptible to infection. So we got to know that pregnant women are prone to infections due to combination of immunological modulation, hormonal changes, physiological adaptations, increased nutritional demands, and greater exposure to pathogens. These factors, while essential for a healthy pregnancy, can also compromise the mother's ability to fight infections effectively. So therefore, it is very crucial for every pregnant woman to take preventive measures such as vaccinations, proper hygiene, eating balanced diet, and regular prenatal care to protect both their health and that of their baby as well. Thank you so much for staying with us on today's episode on Health Talk with Fifi. I know we've learned a lot on why pregnant women are prone to infection, and one way or the other, we'll advise our mom, our sister, our auntie, or a friend. Kindly like, subscribe, share, comment this video, and also follow us on all socials at Health Talk with Fifi. My name is Ajwa Duma Ansa, and this has been Health Talk with Fifi. See you same time next week. Bye.